Hello, I'm Jennifer Whiteside, HEU's Secretary Business Manager. Earlier this month, the BC NDP government made a bold and decisive move. It will now enforce laws to stop extra billing for publicly insured medical services in BC. Making sure that patients in pain can't be exploited and that access to care is based on need, not wealth, is central to our union's progressive values. HEU members should be very proud of this development. After all, having universal public health insurance has been a priority of our union for decades. In 1958, at our union's first biennial convention, members called for a national health insurance program, and we've been fighting for universal health care ever since. That's why we're commending this recent step from the NDP government to deal with extra billing. For the last 16 years, the BC Liberals refused to enforce existing laws to end this illegal practice. It's been an era of don't ask, don't tell, where government shortchanged the public system, forcing many BC patients to pay out of pocket for health services that should be covered. That refusal to take action meant that the federal government recently fined BC $16 million for violating the Canada Health Act. So the decision by Health Minister Adrian Dix to enforce the law and ban extra billing is welcome and necessary if we're to avoid even steeper fines in the future. But it's not good enough to ban extra billing. We need to make sure that services are there. That's why it's encouraging that the Health Ministry has committed to building capacity in the public system for MRIs and day surgeries such as hip and knee procedures. For instance, they announced a 34% increase in hip and knee operations this year. And they've added 37,000 additional MRI exams. By investing in more evidence-based public healthcare services and cracking down on extra billing, the provincial government is getting our public healthcare system back on track. This is a very important step forward for BC. And I encourage all of you to reach out to your local MLA. Let them know how much you support this work. Thank you.